Welcome to ChiroSphere, where we talk about all things chiropractic and some things, well, not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of ChiroHealth USA, the network that works for chiropractic. I'm really excited to introduce our guest to you today. He is my longtime friend and mentor, Dr. Mario Fucinari, with over 35 years of experience running a successful chiropractic office. Dr. Fucinari is a true expert in our field. He's not only a seasoned practitioner, but also a practice consultant, certified professional compliance officer, certified physician practice manager, and certified insurance consultant. And sometimes I think he's just certifiable. Dr. Fucinari travels nationwide, sharing his vast knowledge of documentation, compliance, and delivering optimal patient care. So let's get ready to learn from one of the best in the business. Mario, I know what you do because I've been around you so many hours. I've spent hours and hours in your compliance classes. So for those that don't know you, what I always like to ask is, we're going to find out some of what you do, but I'm really interested in what Simon Sinek calls your why. Why have you gotten so involved in this side of the profession, the documentation, the coding, the compliance? I mean, didn't you have enough to do just running a busy practice?
Well, Ray, first of all, thank you for having me. It's really an honor to be here with you and all of our listeners here. We always say, and I believe that God's got a plan. And so I was going to retire from practice in March of 2020. And if you think back to March of 2020, I was going to be gone and just go golfing and play pickleball as of April 1st, 2020. And I remember it was March 17th, and my wife said, "You're not going back to the office. We have this COVID thing." Right? And so we were about to leave anyway to move to Arizona. So I moved to Arizona, and it wasn't too much longer after that, probably May of 2020, I got a call, and I was asked, "Can you teach virtually on Zoom?" And I said, "Sure." And then I called up my daughter after I got off the phone and I said, "What the heck is Zoom?" And so, as far as the why, number one, and I mean this sincerely from the heart. This is not rehearsed, so everybody knows Ray and I don't know what questions he's going to ask me. But the key is, I really believe in the power of chiropractic. And I mean this like with all my heart here. I used to be, in my former life, I was an x-ray tech and came from a medical background. My wife is a nurse and still is a nurse. And so it's like, I got into chiropractic and I knew this was what I wanted to do. And I literally see the miracles of chiropractic. But I like to also to help and to nurture doctors, and as you know, I teach all over the United States, whether it be virtually or live still. I teach at all the chiropractic colleges and so forth here. And I want to help doctors out, but there's a clinical aspect, which I help them with, but then there's a business aspect too. And a lot of that I had to learn on my own, like most of us, because we're all little islands and we're not business people. Okay. And so it's that passion. And I love, like, if a doctor calls me up and says, one of my clients, and says, "Hey, this is what I'm finding on x-ray. What do you think? This is what I find." And I'll ask them this question or that question. And then we go through how to treat the patient. And I love it. I still love it. It's kind of my way of treating a patient, even being retired, is when they call me back and they go, "I can't believe how much better they're doing." And I just had a doctor the other day. She said, I can't say chiropractic does this, but it did it, that the patient not only is feeling so much better, even her handwriting has improved because she's not so jittery anymore.
Yep.
And it's like, yeah, this is what we do. And without drugs and without surgery. So I'm literally getting goosebumps right now thinking about it. But that's the kind of stuff that I deal with on a daily basis, just helping doctors. And then the worst and is doctors who then get audited and are stressed out. And I help a lot of doctors in that too. But I've had 2 doctors who committed suicide in that audit process. And like one of them shot himself, killed himself, left, and they still went through with the audit. They had to, and they recouped $28,000. And it's like, you committed suicide for $28,000. So I I would rather much help them with the business aspect, um, so that they don't get in trouble than having to help them when they do get in
Yeah, so a couple of things I heard that really speak to me. Certainly the miracles of chiropractic. I happened to be at Cleveland University this past weekend teaching, and I got to hear Heidi Havoc. And I don't know if you've had a chance to hear her recently,
Yes.
but she was talking about, the real effect that we have is certainly it's at the spine level, but the real changes are occurring at the brain level. And it really is, everything we've said for years, decades as chiropractors, we haven't really been able to, haven't always been able to prove that. But you mentioned like the handwriting improving. Heidi was pointing out so many things that happen neurologically when we do adjust the spine. Things that, like I said, we considered them chiropractic miracles because we really didn't have a way of explaining the mechanism behind it. And it's really neat to see the research come to light about the true effect of what chiropractic can do for people. The other thing I heard you say, Mario, that I think is somewhat unfortunate in our day and time. You mentioned getting on the phone and talking with a doctor, helping him with maybe case management or with something, or maybe part of their billing issues or whatever. I remember all those conversations used to happen in our living room when my mom and dad would have their colleagues, their friends over, at least once a month. We actually, they actually got together and shared ideas and lifted each other up and talked about cases and problems they were experiencing. And, unfortunately, I think we've lost a lot of that in the profession. And I too, I get jazzed by being able to help somebody go through something or avoid something where I paid some stupid tax, and I've paid a bunch of it over the years. Just something about that giving back that is truly rewarding.
I consider myself one of the old timers now, although I don't wear white shoes and I refuse to have a plaid jacket, like the old timers.
Plaid jacket and striped pants.
Well, yeah, exactly. But when I went to Palmer Davenport, and when I was going to school there, they taught philosophy, but also we would have speakers come in, and Clay Tuttle and Victor Strang and everybody, and like you and to use your terminology, we used to get jazzed about chiropractic. And I think now it's kind of like, okay, I need to get my hours. And so many doctors want to do virtual or whatever, but they never get jazzed. And I see so much, I was going to call it apathy, but is it apathy? Is it depression? And it's kind of like, I just want to know how to make more money. I had one doctor say that to me. And it's like, what happened to that fire? We used to say, if that doesn't make your fire burn, then there's, your wood's all wet. Okay. And it's like, what happened to that fire within here? Because I make good money. I've always made good money. I obviously haven't gone through a starvation period, but it's because we're rewarded for the services we do, but we have to care for our patients and not just to make money too. So I think maybe that's part of it. It's like continuing education, compliance, risk management, all that other stuff. You get your hours for it, but do you ever get hours for philosophy? I don't know. I think so. Maybe they cloak it as ethics. I just see that kind of that spark, that fire within kind of getting lost nowadays.
Yeah, it's interesting. We both know Mark Ayla from Illinois, and as I understand it, the laws in Illinois pretty much allow anybody to put on CEUs for doctors, and for a state association, that it can make it kind of hard to compete or thrive. And Mark mentioned years ago, he said, we give doctors what they want to hear, things that will help them build and grow their practices, because they can go get their CEUs elsewhere. You've taught a whole lot more than I have, and we could share with everybody how many times we're in the room lecturing. There's the people up front that are engaged, but unfortunately, a lot of them are sitting in the back room, watching the football game or watching Netflix. And I don't think that they realize the missed opportunity they have by not being engaged and not engaging with the colleagues, like they used to do at the old Parker seminars. I mean, I remember 66, 67 going to Parker with my folks. They were both chiropractors, and while you certainly learn things in the class, you probably learn just as much or more in the hallways or going out to dinner or associating with each other. And I think, well, why is it our profession seem to be, we get out of school and then we're like an island. We don't stay connected. And I think part of our challenge is you look at our training model, and we really are kind of taught to be an island. We do our own exams, we do our own x-rays. There's not collaboration with other healthcare providers. You do it all. You're kind of a one-stop shop.
Yeah.
And so there isn't a lot of interaction. Years and years ago when Parker was around, some of those others, and even going back to the early days of chiropractors had to band together almost to kind of survive and to support one another. Well, one of the benefits of success is it doesn't require you to do much of that, but man, at what a cost, not to be able to build that camaraderie with your fellow chiropractors. And trust me, there's hardly anything that you or I haven't been through that everybody else hasn't gone through. And sometimes people, they like you mentioned, the doctors that committed suicide. Unfortunately, we had 2 doctors in our state that committed suicide after an audit, and during an audit. And it's like, man, if they had just reached out to someone that could help them navigate that, it's really sad that they felt so desperate that there was nothing they could do except choose that alternative. And so the takeaway to everybody listening: stay connected with your colleagues, stay connected with your friends, people who walk in the same walk, and reach out to people when you need help. So we both practiced about the same amount of time, about 35 years. And man, have I seen changes, especially with my parents being chiropractors. But what do you think are 2 or 3 of the most significant changes that you've seen in chiropractic over your 35 years?
Well, obviously reimbursement going down. That, when I first started in practice, it was the Mercedes 80s. Then we went to the Nissan 90s, and now we're the tricycle 20s, So, we've really come down. And the first slide when I teach post-grad education is you got to work smarter, not harder. And so, that aspect there. And we don't want to get into the medical model where, it's like, oh, I saw the medical doctor for 3 minutes, but, our hands do a lot of the talking. I always tell doctors, when does a dentist talk to you? Okay. They speak full mouth language, like that, because your mouth is open. I talk to the back of heads all day long, right? When I'm adjusting them. So I think that's a major difference here. But, in practice over the years, I think having employees, and the business side of practice has really changed over the last 30 years, 20 years for sure. It's tough. It's so many doctors are trying to live a lifestyle that we were led down that past, maybe in chiropractic school, you're a real doctor, which I believe we are. But, and so I need that BMW, I need that Mercedes, but then they're horrible business people. I don't know. I talk to so many doctors. I don't want to be a Debbie Downer here, but I talked to so many doctors, and I said, okay, what percentage profit did you make? What's your over? And they have no idea how much you
Amen.
have it's receivable. They have no idea. I just talked to a doctor yesterday, and he said my stats are down. I said why? Um, and so I said, look up your schedule from September 16th. And I said, on that day, that was a Monday, what patients that did you see that day who you're not actively seeing now? And he looked, and then I said, okay, do it for the whole week. Do you know there were 14 people just in that 1 week in September who have since dropped out of care, and he didn't realize it. And I said, why don't you have your staff call them and do a recall or reactivate it? And he did, by the way. And I talked to him yesterday. This was 2 days ago. I talked to him yesterday and go, how many out of those 14 people did they call? Yes. How many came in? 6. It's like, oh. And all you do, you don't say, hey, you need to get back in. You just say, Dr. Fucinari asked me to give you a call and see how you're doing. And we just want to let you know you're welcome. And the person says, you know what? I was thinking of coming back in anyway. I'm glad you reminded me. But it's just looking at your stats and letting your stats, your practice metrics we always talk about. You got to be a business person about that here too, and read your community. I know a lot of doctors want to have a cash practice, and there's nothing wrong with that. But if you're in a highly industrial area that has, blue collar workers that have, depend on their insurance who are living paycheck to paycheck, a cash practice may not be the ideal situation, and you maybe have a hybrid practice, to take care of everybody. So it's just reading the tea leaves there. A lot of doctors, we're not trained to be business people.
Yep. We had that conversation several times over this past weekend in Cleveland. There are an awful lot of doctors who are busy and broke.
Yeah.
Again, because they're seeing a lot of people, but it doesn't matter what you make; it matters what you take home. And I'm like you. One of the things that we teach is know your numbers. If you don't know your numbers, you really can't make good decisions. That's why you might end up with, the brand new BMW every year because you really aren't looking at your books. Some of us do what's called bank balance budgeting, meaning if we got money in the bank the day we decide to go buy something, well, we're all good. One of the other things that you mentioned, and again, I know some phenomenal practices that are all cash, but I'm also hearing from people that have been all cash that are saying, we're really good at what we do. We have a high value, and so our patients are willing to pay cash, but we're just not seeing enough people coming in the door. And I share with them an article that I did years ago called "Cash is King, but don't forget about the Queen." And the whole focus of the article is who's the decision maker in healthcare for the family? It's the wife, typically, the wife of the family. And we did a survey of the general public, and Mario, something like 73% of the people surveyed said they would not go to an out-of-network provider, and that number was 83 or 84% if answered by the females. And those are the healthcare decision makers. Yeah. And when you look at in chiropractic, depending on whose numbers you believe, if we see 10 to 15% of the population, you look at your potential volume of people that might come in, and if we're only seeing 10 to 15%, and now you're going to take 70 to 80% of those, and they won't come in to see you because you don't accept their health insurance, all of a sudden that pie really, really shrunk. And then, the other, one of the other challenges was that is you just created a smaller pool. And I'll ask doctors, I'll ask you, Mario, you wreck your car. are you going to take it to a shop where that you can file your State Farm insurance, or are you going to take it someplace where you can pay out of pocket? And the doctors usually go, well, heck yeah, I'm going to take it to a network or to a shop that is going to accept my insurance. And I say, why do you think people are any different when it comes to their health care? I mean, we spend thousands of dollars, some of us a month, and certainly tens of thousands of dollars a year. And to have someone not accept the insurance that I've paid for, it can create a barrier for some. And again, I want everybody to be clear. I'm a fan of cash practices. I'm a fan of mixed practices, but I'm a bigger fan of chiropractors doing well and being successful. So whatever that looks like to you, great. But if you're finding yourself with a challenge with just the sheer volume of people coming in, you need to start thinking about who you're serving and what's important to them rather than what's important to you, because it could be coming at a cost. So go ahead.
Think about the philosophies of practice here. And so let me give you two scenarios. Okay. You have the emergency room. Okay. Now, does an emergency room doctor put a patient under a treatment plan? No. Okay. They come in, fix them up, go and get out of here. Okay. And they're done. Right. And there's nothing wrong with that. We have a place for emergency care. Okay. And so when a patient comes into your office, being a chiropractor, our attendees here today, what are your thoughts here? Do you want to fix them up, get them out of pain, and then call me when you have pain again? Then in that aspect, many of the insurances, Medicare, Blue Cross, those kind of insurances there, they'll say, well, that's not a treatment plan, and where the patient's coming in as needed basis here, and that's not medically necessary, although that's what some people want. And if I have a busy, if I had 4 kids and I'm working full time, and my wife's working full time, I'll call you when I need you. That type of practice might be amenable to having a cash practice. Okay. But then you have other doctors who I talk to, and one of them is like, I know I can fix this person up and then get them well to MMI. And then after that, come in for a tune-up, right? And I tell my patients all the time, I would kid with them. I'd say, Mario's Body Shop, I do a front end alignment, a back end alignment. We don't do lube jobs, right? And they would laugh. Okay. But you know what? A patient would come in and I'd say, how are you doing today? And they go, great. I just need a tune-up. You see, it's like, oh, it's sunk in. And when you give them that visual, it's just like that pinched nerve. That pinched nerve is like a tornado. But once the tornado is gone, we got to clean up the mess. That's rehab. And when I talk to doctors, oh, I just want to make more money. Okay. How about rehabilitation? Oh, I don't know. Okay. And I was teaching not too long ago. Actually, I was teaching in Las Vegas. And there were, the room was full. And I said, how many of you do rehab in your office? And 6 people out of probably 80, 6 people raised their hand. Okay. And I go, okay, how many of you, whether you give a sheet of exercise to a patient, how many of you at least prescribe some exercises for your patient? And it was like almost the whole room raised your hand. I said, but if you spend 8 minutes or more, you can bill for it. And you could just see some doctors like, it's like, why are you leaving money on the table? Right. And so that's why I said, it's not working harder. You're already doing that, but working smarter. Don't leave money on the table, but still don't you, it's like if you have a knee replacement, obviously you're going to have physical therapy. If you have a heart attack, you're going to have cardiac therapy. We chiropractors, we do disc therapy, disc rehab. So your patients just should be taught that right off the bat there. So it's kind of what kind of model, what kind of philosophy do you want? But then charge for what you do. You would never go to Walmart and they go, well, here, you can have these eggs for free today. And, or doing an exam, consultation exam, and x-rays for $20, like some offices I see advertising here. I mean, what kind of patients are you attracting? So
Yeah, it's a challenge. Well,
Yeah.
hang tight, everyone, while we take a quick break to hear from our sponsors. Welcome back to our podcast. I'm here today with my friend, Dr. Mario, having a great conversation. We were just wrapping up talking about therapy and rehab. And Mario, I can tell you, when we added rehab into our practice, we actually got better outcomes. And we're truly focused on helping the patient. I think that is an important part of a practice because let's face it, somebody that's had chronic or even acute back pain, how many people come into our office that are truly elite athletes in great shape with great flexibility? That wasn't my patient base. Maybe if you're a sports chiropractor, that's probably increases the likelihood. But let's face it, people come in, they have weakness, they have patterns of movement that they've adapted over time. And, if you wonder maybe why some of your patients don't get better and stay well, it's because you're doing the right things and adjusting them. But if the supporting structures, their flexibility, their range, if those other components aren't addressed, that absolutely can end up impacting, a patient's outcome. So let me pivot to a couple of other issues. So we talked about some changes that you've seen in your 35 years as a chiropractor. What's the biggest two changes that you've seen and as a practitioner in regards, or as an instructor in regards to compliance? What are doctors not doing that they should be doing?
Probably everything.
Yeah.
Well, it's like,
Narrows it down. Thanks. We hope everybody enjoyed the podcast today.
maybe it gets, now that you said this, maybe here's my thoughts. Okay. When we went to chiropractic college, what year you went, okay, we hung around with our colleagues there all the time. I think I mean, we didn't have two nickels to rub together, but we used to have potlucks and you all get together and, bring the food there and we would talk about whatever. And then you graduate and all of a sudden it's like we're little islands, right? Okay. And that disconnect there as well. But I think from the business aspect of that here, it's like, why don't you do this for increased outcomes here? But it's also compliance. Compliance doesn't make you money. That's the thought out there. But actually it does, because as an example, if I am giving and I'm going over exercises with a patient, shouldn't I be charging for the services I do? I think everybody on this call would say, that's listening to this would say, yeah, but you don't. So Medicare says that's a gift and inducement, and therefore it is illegal. It's a civil money penalty, right? Okay. So that's part of compliance. And then what about HIPAA? Okay. What happens if somebody hacks into your computer and takes and encrypts everything or ruins everything? Okay. Then, a patient complains and then they come in, and like one office that I just recently, in the last few months, dealt with, they had a hack of their computer system, a virus that came in. The first thing that the Office of Civil Rights did, and CMS also investigated, they said, did you do a risk analysis? No, we didn't. $65,000 fine just for not doing a risk analysis.
Yeah.
And a risk analysis takes about 2 hours to do a real thorough one. Okay. But the key is it made money, because if you would have done that, invest 2 hours in compliance, you wouldn't have had to pay $65,000. See? And
Yeah.
so that's the thing. And, just have an administrative day. If you take Thursday afternoons off, are you really off, or are you just not seeing patients at that time? Be an administrator, a business person, and look at the books, practice metrics and everything else, and be compliant, and then document what you do. That's all compliance is.
Yeah. I have yet, and I used to think the same way. Oh, I don't want to deal with all that compliance crap. It's just one more thing to do. It doesn't generate any revenue. But actually, what I found is the more compliant I became, the more profitable I became. And I shared with doctors this weekend. If you get audited for something, maybe charging for services you didn't render, or believe it or not, undercoding and not charging for things, then you're dealing with the inducement thing. And one of the things a simple thing you can do at the end of the day, take 5 minutes and review your day sheet. And you know what I found out when I did that? I might have been seeing a patient and treating 3 to 4 areas and billing that code out. And because we're creatures of habit, they come in, 6, 8, 10 times, and we salt the notes, same as last time. But they may be doing better in their lower back, and now I'm just adjusting their neck, which is a 1 to 2 area. But if I get audited, guess what that looks like? I'm continuing to bill for 3 to 4 areas when I only adjusted 1 to 2. I wouldn't. And when you're busy during the day, you don't always look at little things like that. But at the end of the day, when you recap, you say, oh, I'm not treating her low back anymore. I'm just adjusting the spine. Well, don't let it stop there. What I did to document that I'm at least trying to mind my practice and make sure I'm doing things right, I'd shoot an email to my, or in-office email to my front desk and say, I did not adjust 3 to 4 areas, reduce that to a 1 to 2 area. I just document that I'm doing my job and trying to make sure I'm compliant. And here's the other thing that happens. How many times have you been in a busy day, a patient comes in for their low back and they tell you, oh, by the way, I fell down the stairs last night and I hurt my neck. What do? You do range of motion, you do an exam, you do palpation, you probably adjusted it. And guess what you probably didn't do? You probably didn't bill for the exam or increase the number of regions you were billing for. So that's 2 ways compliance really saves you money out of preventing audits, but it also can generate revenue by making sure that you are charging for what you do. Because if you don't have something like that, you're absolutely leaving revenue on the table. So don't look at compliance as something that costs you money. If you do it the right way, it can actually increase your revenue, not only increase the income, but lessen the likelihood that you have a fine or penalty. And let's face it, some of the fines that we see can be absolutely career ending. So, while we may not like the idea of compliance, it is something that we're required to do. And Mario, I just read an article this past week that the average medical doctor spends almost 50% of their time doing non-clinical work, answering stuff from the insurance companies, dealing with pre-cert, dealing with all the crap that we have to deal with in healthcare these days. That's a travesty. And if you don't want to do that stuff yourself, surround yourself with the right people that can handle that for you. In the medical world, they call that physician extenders. So have someone that's going to, dot the I's, cross the T's, making sure you're staying on track. Because again, I think it will not only save you money, but make you money.
One of my favorite mentors, I call him Obi-Wan Kenobi. His name is Ray Foxworth, and I've been to his classes before, and he used to say MD stands for more dollars and DC stands for Doctor of Creativity, right?
Yes, it does.
But the reason why more dollars, if you think about it here, and I'm not advocating that we chiropractors do this, but what doctors are learning coding, okay? They just circle a number on sheets here. They have coders who are out there, but so many of us, we don't have coders, we don't have staff, or whatever, or you don't send your staff to training as well. So they don't know either. So again, it's like you're showing exercises to a patient, and yeah, I take probably 10 minutes. Well, that's 97110 bill for it, okay? And you might be surprised of how many insurances would pay you without even questioning it. Just like an exam, and a self-limiting exam with minimal or no actual exam, one problem, self-limiting, no risk. Well, that's a 99202. That's not your typical patient. 2 or more problems that you're doing an exam, maybe x-raying, analyzing it. that's a 99203. Two or more problems, and you're still doing an exam, maybe looking at past external, records, medical records, and they have some systemic problems. That's a 99204. How many chiropractors actually charge a 99204? Hardly anybody, right? And so the key is the new guidelines, they're not aware of those guidelines that changed in 2021, and they're still learning stuff they learned in 1995. So, by taking a class, getting back to education and training your staff as well, that's one way to, it's like planting a seed, that return on investment. You're going to get that money back again, looking at a football game. And like you said, people, I had one guy, it was in Missouri, by the way. I won't say the city, but it was in Missouri. And I walked to the back of the room and he's actually watching a fishing channel. And oh, fishing is boring. And sometimes that's a good way to get away.
Watch the paint dry.
But yeah, it's like watching this in class here. By the way, I was teaching in San Francisco one time. Everyone sat in the back. I actually brought the podium to the back of the room. You should see their face. It was great. So
that's a good.
Yeah.
So anyway, Mario, we got people of all different ages that listen to this podcast and at different stages of their career. What's the one piece of advice you would give to a new graduate coming out of school to help them build their practice, sustain it, and be compliant at the same time?
Have multiple hats. Number one, you can't do it by yourself. Okay. I'm a firm believer, if you can at all, and I know it's tough, if you can at all hire somebody even to answer the phones so that you're with patients or you're running the office. So number one. Number two, train yourself and your staff. Just because you graduated doesn't mean you stop training, but who needs to, again, I don't want to be stepping on toes here, but who needs to keep taking classes on how to adjust a patient when you've been adjusting a patient, and you know how to adjust, but we don't know how to be a business person. And reach out to your colleagues, reach out to, Chiro Health USA, I even, I know a lot, but I even reached out to, people in Chiro Health USA to ask them questions, how to handle this Medicare Advantage patient, how to handle this family plan or whatever. And they have, people they talk to and they have knowledge as well. But, this is how we grow. And always keep in mind, you're a business person and a clinician. And so have those hats and set aside time just to take care of the business and not just to, catch up on your sleep or golf or whatever.
Yeah, I think Michael Gerber said it perfectly years ago. You need to work on your business, not just in your business. And let's face it, unfortunately, a lot of business people can't spell P&L or even know what it is. And if you aren't running, if you're not looking at your profit and loss statement, like I said, you can be a very busy doctor and be very broke at the same time. So make sure, if you don't have that business experience, surround yourself with someone who does. And I don't know if you're aware of it or not, but there are a group of retired business people who are available through the Small Business Administration that volunteer their time to help entrepreneurs. So
Right.
if you're not up on all this stuff, certainly there's advice within our profession, but even if you don't have access to that, take advantage of what the SBA offers and get some basic training in business and business administration. So I got some just for fun questions, Mario.
Okay.
Who's your hero and why?
Well, I would say, and this might sound a little corny, but it's true. Jesus is one of my heroes. And if you really look at the things Jesus talked about, it is a good philosophy for life as well. Okay. That's number one. I don't know. I look at heroes is kind of overblown. I look at mentors, and I have several mentors, people, and I count you, Dr. Ray, as one of them, because, you look internally at these things too. Heroes, I think my wife is there because she kind of settles me down. She puts the pin in the head to make sure I don't get a big head sometimes. So, yeah.
What talent do you have that most people don't know about?
I can paint pretty good ceramics, but you can't see my camera. But I have 3 guitars on the wall here, and I have 2 more in my closet. And behind me, this is a live shot. I actually have an amplifier, and I play a pretty good guitar. So
That's strange. Mario, I've known you all these years, and I did not know you play guitar. And at my home, I've got three guitars hanging on the wall, 2 old amps, and
really.
I had a chance to meet Heidi Havoc's husband this past weekend. He plays guitar. I am dumbfounded at the number of people in chiropractic that play instruments, and I don't know if it's because of our tactile senses or whatever that there are so many chiropractors that are musically inclined and have that history. It's really interesting to see. One final question: what's the worst job you ever had?
Oh, working as a busboy at Jumer's Castle in Bettendorf, because back then they could smoke, in the
Oh
restaurant.
my gosh!
Yeah, and here I am. I was had been an X-ray tech, and was going through Palmer at the time. And if they say, "Can I get a book of matches?" and you would have to put the book of matches on a tray and bring it to them and bend over and give that to them. That job lasted for 3 months, and then I got hired at Mercy Hospital as an X-ray tech, and I was in heaven.
Those are the things that make us decide we want to do something different in life.
But it taught me customer service.
Yeah, absolutely. Well, thanks for spending some time with us today, and thank you all for listening to the ChiroSphere podcast. Please subscribe and share the podcast with your friends, and let us know who you'd like to hear from in the future, what topics you'd like us to cover, and we'll be glad to we'll do our best to deliver. If you want to learn more about ChiroHealth USA and how we can help you develop a compliant, profitable discount strategy that will grow your practice, income, and most important, profitability, call us at 888-719-9990 or visit our website at chusa.com, that's CHUSA.com, to find out why ChiroHealth USA is the network that works for chiropractic and you. Thanks so much, Mario.
Thank you. Take care.